Good afternoon and welcome. Bonjour à tous et à toutes, bienvenue. My name is Lori Zehr, and I am the Dean of the School of Health and Human Services at Camosun College. It is my honor to welcome guests to Camosun College and our dental building. I would like to acknowledge that we are gathered today on the traditional territories of the Wakongan and Wasanich peoples. Today we will hear from the Honorable Jean-Yves Duclos, Minister of Health from Government of Canada, as well as Mandy Hare, our Chair of Dental Programs at Camosun College, and Riley Mayhew, a student representative from our Dental Hygiene Program. Following the speaker remarks, we will open the floor to media for a question and answer period. In the interest of time, we kindly ask that you focus your questions on the top of today's event. It is now my pleasure to invite our first speaker. Over to you, Minister Duclos.
Bonjour tout le monde. Good afternoon, everyone. Merci, Laurie, pour cette belle introduction. C'est toujours un grand plaisir pour moi d'être dans la magnifique province de la Colombie-Britannique et merci en particulier de m'accueillir dans la région de Victoria. I would also like to acknowledge the presence of Mandy Hare, who is going to speak later, Chair of the Dental Program at Camosun College, and Riley, who is a student representative for the Certified Dental Assistant Program. And I'd be remiss if I didn't thank the wonderful and smiling staff and students of the Camosun College Dental Clinic who are our hosts today. It's been wonderful to hear from you and to feel from you how great it is to work and to learn in this great environment. And I know that staff and students at this clinic also see every day the positive effects that good dental care, including early intervention and prevention, can have in the lives of so many patients who have the fortune of being able to come and visit the clinic. Without a doubt, visiting a dental care professional is, as you all know, important not only for oral health, but for overall health. Et c'est parce que la santé bucco-dentaire, c'est essentiel à la santé générale. Lorsqu'ils ne sont pas traités, les problèmes de santé bucco-dentaire deviennent des problèmes graves, qui sont plus coûteux, qui sont plus difficiles et plus douloureux à traiter. Merci donc pour toutes ces personnes qui viennent ici nous voir et pour qu'on puisse prendre soin d'eux, et entre autres parce que le coût des soins dentaires serait autrement hors de portée. As you all know, students and staff, and as you all see every day in your important work, delaying preventative care can have wide-reaching impacts, including costlier treatments, worsening health outcomes, problems with sleep, time away from school and work, as well as mental health challenges. At the same time, as we all know, as we all feel, the rising cost of living and inflation are making it challenging for Canadians and lower and middle income families in particular to afford necessities, including oral health care. Let's therefore be clear, in Canada in 2023, no one should have to choose between taking care of their teeth and paying their bills at the end of the month. And we should not be able to determine a person's salary or income on the basis of the quality of their smile. Therefore, the first phase of our approach to increase access to quality dental care started just a few months ago in December when we launched the Canada Dental Benefit. The Canada Dental Benefit is providing eligible parents or guardians with direct payments of up to $1,300 over 2 years per child to help cover the cost of dental care for their children. More than 250,000 children have already benefited from the Canada Dental Benefit, getting brighter smiles and healthier teeth in the process. In BC alone, it's approximately 17,000 children who have benefited from the Canada Dental Benefit, of whom 3,300 live on Vancouver Island. But children, as we all know, are not the only ones that need better access to affordable dental care. And that is why Minister Freeland, just a few days ago, announced in Budget 2023 an investment of $13 billion over 5 years, starting this year, to implement what is called the new Canadian Dental Care Plan. The plan will provide dental coverage for uninsured Canadians with annual family income lower than $90,000, families that don't have a private or employer benefit plan. For those with family incomes under $70,000, that will come with no co-pays. We're working very hard to get this longer-term plan in place. In fact, by the end of 2023, we aim to improve access to dental care to children under 18, seniors, and all people living with disabilities. That Canada Dental Plan will expand between now and 2025 to include all uninsured Canadians with family income up to $90,000. Eventually, the dental care program will help up to 9 million uninsured Canadians that get the dental care that they need. Now, you also know, living and working and learning in this great environment, that in addition to the cost of dental services, we see that there are other factors which prevent Canadians from accessing the dental care that they need, such as living in a remote or rural community, or requiring specialized or adapted care due to a disability or other forms of barriers. And that is why Budget 2023 also proposes to provide $250 million over 3 years to establish an oral health access fund. That fund will complement the Canadian Dental Care Plan by investing in measures that reduce oral health gaps, especially among vulnerable and marginalized populations. Now, it's quite a happy coincidence to be making this announcement here in Victoria in April, which you will know is Oral Health Month. Now, Oral Health Month is a perfect opportunity to repeat what we all know, that the health of our teeth and gums can directly impact the overall health and well-being of people. And that's why providing Canadians with more equitable access to this important aspect of health is so important. Again, for that to be possible, we need to be grateful and to be recognizing the hard work and the dedication and the commitment of everyone working in the dental care community, but particularly students and staff here at the Camosun College Dental Clinic for your dedication, for your hard work in improving and helping to improve oral health for all Canadians in this community today and in the many years to come, Erin and many others that are with us today. Now, having said all of that, let me now turn to a real oral health expert, Mandy, and Chair of Dental Program, Camosun. Mandy, please come. And again, please feel and accept my words of, and not only my words, but the words of the people in this community of gratitude to your work and the work of your team for making it possible for people to live in healthy conditions in this community. Thank you.
Thank you so much, Minister Duclos, both for coming and for this fabulous announcement. A federal dental plan is something that we've only dreamed about, and even when I was in school a few decades ago, we talked about how a federal dental plan is something that was needed in Canada and overlooked when healthcare and or dental care was being considered. So Camosun College has been graduating certified dental assisting students for almost 50 years and dental hygiene students for 35 years. We have a stellar track record of graduating dental professionals who go on to provide exemplary oral health care to the residents of British Columbia and Canadians. The 10-month Certified Dental Assisting Program educates CDAs to work alongside dentists to provide restorative care such as fillings, crowns, dentures, root canals, and much more. And dental hygienists are oral health promotion and disease prevention primary healthcare providers who also work in dental offices, but more importantly, are increasingly providing care in unique business models, going to areas where the vulnerable, institutionalized, or marginalized Canadians, or those that live in rural and remote areas, so that they too also have access to dental care. Minister Duclos, dental hygienists are the real solution to the access to care issues that Canadians experience. And they can maximize the federal dental plan so that future Canadians will have primary health care and not tertiary care, which is always more costly. Dental offices are good, and they've always been available, and they are important. But many Canadians who need the care the very most do not access them for a variety of reasons. This is where the dental hygiene profession can really move the needle. Dental hygienists are mobile, they can provide care in people's homes or go into rural communities and use real entrepreneurial approaches to make the care accessible. They are primary healthcare providers that do so much more than just clean teeth. They educate, they promote communities, they educate and promote oral health care in communities. They do oral cancer screenings. They refer to other higher healthcare providers. They take radiographs, they do screenings for oral conditions such as cancer, they debride, they do polish fluoride, and so much more, similar to the certified dental assistants in dental offices. Dental hygienists are the 6th largest health profession, and we have over 32,000 dental hygienists nationally. There's 36 schools of dental hygiene and over 100 schools of CDA that provide care to clients. So we see thousands of Canadians in our schools in low-cost clinics and programs. It would be very advantageous to have the federal plan be available to these clients in a continued fashion. This would allow dental hygiene and CDA students to provide care to clients without having to worry about whether or not their plan would cover it. So for schools, it would mean that we could continue to charge a very nominal fee to do the exam, x-rays, oral health education, screenings, tobacco cessation, and much, much more for a very low one-time fee. So please do keep schools in mind when the plan is being rolled out. Allow patients to be able to continue to use our services and allow us to bill to the plan for the same nominal cost so that more of the federal plan can be used to their other more costly needs. I would also like to say that dental plans are wonderful and they should not have limitations on prevention. Prevention is key to preventing further care needed, costly care in the future. So we look forward to further discussions on how schools can help government stretch the federal plan dollars to Canadians and have a maximum benefit from the plan. In closing, I just want to thank government for making the federal dental plan a reality. It is a very noteworthy milestone in Canadian history. I would like... Thank you. I would now like to turn the mic over to Riley Mayhew, a dental hygiene student that will be graduating in a few short months. Riley.
Thank you. Hello, everyone. So I am the senior student, the dental hygiene senior student representative for the dental hygiene program. And I've been at Camosun for 3 years now, and within the program for 2 with the hygiene. I take so much pride in choosing this career for becoming my next career choice and choosing Camosun to do it with. The opportunity of getting to work in the client clinics with people that actually come in and need the care, and they usually have barriers accessing that care. So a lot of the clients we see, they do include friends and family because they do come support us while we're in the program, but we also see a lot of clients that have barriers to accessing care, including some young families, seniors, as well as some low income. So the federal dental plan is an excellent opportunity for our community to be able to access our clinic and use that towards their appointments, and it'll go further, getting the preventative care through the dental assistants as well as the dental hygiene students, and all of the wonderful faculty here that are supporting us. So the care is exceptional. It's very good. It's one-on-one and very client-centered. So it's really exciting about that. Yeah, that's it. Thank you.
Thank you, Minister Duclos, Mandy, and Riley for your words and all the thought that you put into everything that you said. This concludes the formal part of today's event, and so I will now invite Mark Johnson to open the media question and answer period.
Hi. Hi, it's not Mark, it's Guillaume here. So we'll start with a question on the floor. I asked you to ask your question on the mic on the other side, and we'll move to the questions online. Is there any question on the floor? No? Okay, Anne, to you online.
Parfait. Merci, Guillaume. We will now proceed to questions from journalists online with Zoom. If you are a reporter and wish to ask a question, please the hand-raising function. We ask that you limit yourself to one question and one follow-up. Unless I have stated it, please indicate your name and media outlet before posing your question. Nous allons maintenant prendre les questions des journalistes sur Zoom. Si vous êtes journaliste et si vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et une question suivie. Alors, la première question provient de Chuck Chiang de Canadian Press. À toi la parole.
Hi, Minister. Thank you very much for your time. There's been some recent attention on the diabetes epidemic. I was wondering if you could comment on whether the Canadian government is considering any measures in terms of controlling Canadian pharmaceuticals in the U.S. market. Thank you very much.
Sorry, there is your question seems to be very important. However, the sound is weak. So just to be sure that I understand it perfectly well, can you repeat it again?
Yes, I was wondering if you can comment on whether the federal government is going to do anything regarding the possible Canadian pharmaceuticals ending up in the U.S. market.
Okay, I think you refer to a drug being prescribed by physicians in a different province, in this case, most likely Nova Scotia, that are then delivered in BC. Olympic, I think, is the name of the drug. In fact, it's a great question. I'm going to see Minister Dix tomorrow, Adrian Dix, who is the Minister of Health in BC, to recognize that this is a serious, legitimate concern for people living in this province. It's an example of a drug which is absolutely essential, and Canadians have the right to access it in the appropriate and timely manner. Second, that I understand from Minister Dix that he has taken strong measures to make sure that the drug would remain accessible to Canadians and British Columbians in particular. And third, to see with him whether there would be a need and a value for the Canadian government to support his efforts, working with other provinces, so that when a drug is prescribed by a physician in a different province and then made available to non-Canadians through BC pharmacists, then that this issue is not causing difficulties for people living in this province.
Thank you very much.
A follow-up, Chuck, or no?
I'm okay. Thank you.
Thank you. Next question is from Wolfgang Deppner. Please state your outlet, please.
Hi, can you hear me?
Yes, we can.
Okay, excellent. Hi, good afternoon, everybody. Thank you, Minister, for taking my question. It's Wolf Deppner, Black Press Media, and just curious about the threshold for the dental program. What, if any, plans do you have to raise the threshold? Obviously, the threshold is as it is now, but what, if any, plans does your government have to potentially increase the threshold for Canadians, because a good number of Canadians are still short. A good number of Canadians are still find themselves above that threshold before they become eligible for the additional support. How did your government come up with that figure, and what, if any, plans do you have to perhaps raise it in the future? Thank you.
Well, thank you for the question, and you're correct to point to the fact that oral health and dental care are particularly important for some groups of the population, essentially either because of not being able to access or to use an employer plan or a private plan to have a proper oral health care, or because family incomes are modest or low. So that's why we're focusing in the immediate term on those Canadians that are non-insured, not having, for example, access to an employer dental plan, with family income below $90,000, because this is where we see that the vast majority of Canadians who need good oral health care don't receive that quality oral health care. So the vast majority of Canadians who won't go and visit a dentist or a hygienist or receive dental care, the vast majority of those Canadians meet those two conditions. They don't have access to a private insurance, and they have limited family incomes. So that's what we're going to do in the next 2 years, and then thereafter, as we assess the social, the physical, and other types of values of these investments, we'll be able to revise our investments in oral health for Canadians.
Follow up, Mr. Debner?
Yes, thank you. Question about geography. You talked about this a little bit earlier about getting dental care into the more rural and remote parts of the country. In British Columbia, which specific measures would you like to see, or which specific measures is your government pursuing when it comes to making sure that dental/oral care is going to be available in the more rural and remote parts of the province? Read Places Beyond Hope.
Great question. A couple of things about that. First, it's correct to state that in Canada, including in BC, we have a two-speed healthcare system. If you live in an urban area or close to an urban area, you have access to healthcare that can be quite different than if you live in a remote or rural community. The second piece to that is that the investments we're making in support of provinces and territories through the $25 billion that the Prime Minister announced just a few weeks ago, when we want to improve health and healthcare outcomes for Canadians. Many of these dollars we would expect provinces and territories, including in BC, to be used to support greater access to healthcare in remote and rural communities. The third piece is that, as we just heard a couple of minutes ago, dental hygienists, dental assistants, dentists, certainly, but I would point more specifically to dental hygienists and dental assistants, can make a big impact in more rural and remote communities. Now, in many cases, the question is access, and proximity of access to communities. It could be public health facilities. It could be schools. It could be community centers. It could be seniors' residences. So the dental hygienists in particular, and other dental care professionals, have demonstrated, and with the leadership of this clinic, are demonstrating that they can reach out to people and communities that may live physically or socially far from larger centers like big cities. So that's why we have major hopes with the leadership and partnership of Camosun and other teaching and training places. We have great hopes that their efforts in training more dental care professionals will be helpful in reaching out to those communities and those people where the needs are often the greatest, but the access is often most limited.
Nous n'avons plus de questions sur Zoom. De retour à vous, Guillaume.
Merci. This closed the press conference. Thanks to everyone here for the warm welcome, and including the students behind you, Minister. So thank you.
Thank you to everyone. If there had been more complicated questions, I would have turned to you. So